All right, today we're tackling a big one, Riociguat. It's a really significant medication for a very serious condition, and we're going to break down exactly why it's considered such a major leap forward in treating pulmonary hypertension.
But let's just start with a question. What if you could fix a communication breakdown, one that's happening right now, deep inside your own blood vessels? Because at its heart, that's the exact problem this drug was designed to solve.
Okay, so to really get the solution, first we have to understand the problem. And it's a big one. Think of it like a dangerous pressure cooker building up inside the lung.
That pressure cooker has a name, pulmonary hypertension, or PH for short. Put simply, the blood pressure inside the arteries of the lungs gets way too high. And this puts a massive strain on the right side of your heart, forcing it to work harder and harder just to pump blood through, until, eventually, it can start to fail. So yeah, the stakes are incredibly high.
So you've got this life-threatening condition. What do? Well, it was clear that medical science needed a totally new game plan, and that led to an entirely new class of drug. And that brings us to our subject, Riociguat, which you might know by its brand name, Adempas. Now, what's so cool about this is that it was the very first drug in a totally unique class called SGC stimulators. This wasn't just, a minor tweak on an old idea. It was a completely new strategy for fighting this disease.
So, how does this new strategy actually work? Well, this is where it gets really clever. The genius of Riociguat lies in its unique dual action. It doesn't just do one thing, it attacks the problem from two different angles at the same time. To make sense of this, let's use a simple analogy. Just think about the process of relaxing your blood vessels like it's a communication system. You've got a messenger, a receiver that gets the message, and then an action command is sent out. Simple enough, right? Now, in a healthy body, that system works perfectly. The messenger is a molecule called nitric oxide, or NO. It zips over to its receiver, which is an enzyme called SGC. Once SGC gets that message, it sends out the action command by producing another molecule called cGMP. And the result? Your blood vessels relax, they get wider, and blood pressure goes down. Perfect. But in patients with pulmonary hypertension, this whole communication pathway is broken.
And this is where Riociguat's brilliant two-pronged approach comes into play. First, it does something called sensitization. It basically makes the receiver, that SGC enzyme, way more sensitive to whatever faint signals of nitric oxide the body can still produce. It's like turning up the volume on a really weak radio signal so you can finally hear it. But then, for its second trick, it can actually bypass the messenger altogether and directly stimulate that receiver all on its own. It's a built-in failsafe, making sure that relax command gets through one way or another.
Okay, so we've got this incredible dual action mechanism. But how does that translate to the real world? Who specifically can this drug actually help? Well, Riociguat is approved for two very different forms of pH. The first is something called CTEPH, which is when the high pressure is caused by old, stubborn blood clots that are physically blocking the arteries. The second is called PHA, where the problem isn't clots, but the actual walls of the arteries themselves getting thick and tight. So you've got two different causes, but one powerful solution.
The use cases are really specific. For those CTE patients, the ones with the clots, it's used when surgery to remove them just isn't an option, or if the high pressure sticks around even after surgery. For PAH patients, the goals are a little different. It's used to help improve their ability to exercise and, critically, to help delay the disease from getting worse.
Now, as you can imagine, with a drug this powerful and this innovative, it comes with a very strict instruction manual. And these aren't just suggestions, they are absolutely critical rules for keeping patients safe. And the first rule is the most important one. It carries what's called a boxed warning. That's the most serious type of warning a drug can have. Let's be crystal clear. Riociguat is absolutely 100% contraindicated in pregnancy. It can cause devastating harm to a developing fetus, including miscarriage. There is zero room for error here.
Because that risk is so severe, there's a mandatory safety program for any patient who can become pregnant. This involves regular pregnancy testing before, during, and after treatment. It requires using two reliable forms of contraception, and it means enrolling in a formal safety program called a REMS. This is all completely non-negotiable. And the warnings don't stop there. The next one is just as serious. There are some very common medications that, if you combine them with Riociguat, create an incredibly dangerous, even life-threatening situation. So listen up, because this is a critical point. Riociguat must never be taken with nitrates, think nitroglycerin for chest pain, or with PDE5 inhibitors like sildenafil or tadalafil. Why?
Well, all of these drugs relax blood vessels, and if you combine them, the effect adds up and can cause a person's blood pressure to plummet to dangerously low levels.
So to balance all these benefits and risks, finding the right dose for each person is a really careful, methodical process. Doctors start patients on a very low dose, and then they slowly increase it, usually every 2 weeks, all while keeping a close eye on blood pressure. The goal isn't just to rush everyone to the max dose, it's about finding that just right, individualized dose for each patient. Now, of course, with any powerful medicine, you're going to have some side effects. A lot of them are actually related to what the drug is supposed to do, widen blood vessels. So things like headaches, dizziness, and low blood pressure are pretty common, especially when you're first starting out and finding that right dose. You might also see some digestive issues, like indigestion, nausea, or diarrhea.
Okay, so let's pull all of this together. What's the big picture takeaway from our dive into Riociguat? It really comes down to this. It's a powerful but very precise medical tool.
The bottom line is, Riociguat isn't just another option on the shelf, it is a pivotal therapy. By offering this completely new, dual-action way to fix that internal communication problem, it gives real hope and real clinical benefit to patients with two very tough forms of pulmonary hypertension.
But, and this is a huge but, all of that innovation comes hand in hand with immense responsibility. Its power can only be used safely under the care of a doctor who's an expert in this disease and with a patient who is totally committed to following those strict safety rules to the letter.
And that kind of leaves us with a final thought, doesn't it? The science behind this drug is a legitimate breakthrough. But for a medicine this powerful, with such serious risks on the table, you have to wonder if the careful, meticulous management of it is actually the most important ingredient of all.